Good morning, everyone. I'm Jim Wunderman, President and CEO of the Bay Area Council. The COVID-19 pandemic has upended all our lives in profound and painful ways. Many of the impacts we're feeling already, and many others will be emerging in the weeks ahead and the months ahead. The Bay Area Council is working furiously to bring some clarity to the confusion to help the Bay Area navigate these extremely difficult times. We're blessed with incredible member companies and great business leaders armed with the skills, knowledge, expertise, and creativity to overcome the challenges that we face. You're going to hear from some of them today. We plan to have more of these webinars on subjects that are relevant, and especially relevant during the crisis, and welcome ideas from those listening today on ways we can provide important content. Now let me turn it over to Patrick Halloran. Patrick is the Research Director for the Bay Area Council Economic Institute, and he will lead us in today's session. Thank you.
Thank you so much, Jim. And thanks everyone to attending the first in a series of hopefully many Bay Area Council webinars. As Jim mentioned, I'm Patrick Halloran. I'm Research Director at the Bay Area Council's Economic Institute, but I'm also lead for the Council's health policy work. And as Jim mentioned, these are uncertain and challenging times, both for the health of ourselves and our loved ones, but also for our livelihoods, businesses, and the economy. And the Bay Area Council realizes that this uncertainty is unsettling, but believes that together we can get through it. And one way that we think we can get through it is through this series of webinars, of which this is the first. And this is intended to bring together experts from across the region to share, discuss, and collect best practices and learnings from and to the region. I'll also mention that our Economic Institute is doing regular updates on the state of the economy and has even put together a set of maps explaining where and which Californians might be the most vulnerable to both health and economic impacts. So I'll kick things off. Today we have two wonderful guests, and I really appreciate the time that they have given us today. They're both a little bit busy, it sounds like. And so to kick things off, we have Dr. William Isenberg from Sutter Health and Kristin Rivera from PwC with us today to talk about how health systems are responding to this unprecedented crisis, how businesses can maintain continuity in uncertain times. And we had hoped to have Mayor Breed join us, but we just received news she's not going to make it. But that's okay. First, we'll hear from Dr. Isenberg and Kristin individually, and then we'll leave plenty of time for Q&A. So just one housekeeping note. We have a little Q&A box. If you hover down on your screen there, you can see Q&A. Actually, two folks have already submitted questions, so folks are already on it. And so once we get through the two sort of little individual 10-minute sessions, me and the staff at the council will curate some of your questions, and we'll pose them to Dr. Isenberg and Kristin. All right. Let's get started. Dr. Isenberg is Chief Quality and Safety Officer at Sutter Health, where he leads the system's effort to empower staff and providers to use error prevention tools and other high reliability strategies that keep us and their patients safe. He's also Sutter's Incident Command Operations Chief and Medical Officer, and therefore is overseeing much of Sutter's response to the crisis at hand. And as if he needed one more thing to do, I've enlisted Bill into being the co-chair of the Bay Area Council's Healthcare Committee, and him and Sutter have been so gracious. Bill, thank you so much for taking the time to join us.
Thank you, Patrick. It's very nice to have this opportunity. I think Patrick asked me to take on this role of co-chair and the first meeting I co-chaired was on the very day that Mayor Breed declared a state of emergency due to COVID-19. So it was an auspicious start to this relationship, but I think it's going to be a very productive one, and I'm very excited to join the ranks of the Bay Area Council. I thought it would be well for us to begin this conversation just with some data first. Every day we get a report from the Office of Emergency Services from the state of the number of positive COVID patients and the number of deaths that can be attributed to that. This morning's report, which is actually completed at around 7 or 8 o'clock the night before, tells us that we have 3,006 Californians who are currently COVID positive. And as of yesterday, we had experienced 61 deaths. Now that's an increase of 23 from the day before. And last week, when I gave a very similar webinar, the number of COVID positive patients was 576. So you can see that we're starting into the point within this exposure when our numbers are starting to climb pretty rapidly. It is interesting, I think, when we look at it from the Bay Area perspective, that a vast preponderance of the positive patients are actually here in Northern California, and more than 60% of the deaths have occurred in our region. In fact, there were 471 new cases, and within our own area, about 100 of those were in Northern California. Interestingly enough, San Carlos is the second largest community with positive patients, exceeded only by Los Angeles County. So that's pretty sobering. Now, we might be getting a little bit concerned and upset about that, but in fact, some of that exposure happened because we were ports of entry for some of the Travis patients that came off of the Japanese cruise ship, as well as when the Hawaii ship was brought in, it came into our own docks. So our facilities actually were exposed to caring for exposed patients quite early, and it in fact activated our systems earlier than may have happened in other parts of the country. I can tell you, at least at Sutter Health, we actually activated our emergency management system in the second week in January. So we were already anticipating things might go awry very early on. And we started partnering with our colleague healthcare systems across Northern California. We started meeting weekly to ascertain where we might go if we had to face a surge. And we were really fortunate that we did begin that process. I do think it might be well, Patrick, are you open to putting up a slide? I supplied you with a slide that maybe the audience, we could share right now.
Oh, right. We had a little bit of, sorry about that, technical difficulties with switching Bill's camera out.
If there's tech difficulties, no worries. So there's a book, I'm going to hold it up right now, and it's called Managing the Unexpected. And those of you that are on this call, you're leaders, and you're leaders because you're voracious readers, I'm counting on. And I would strongly recommend that you pick up a copy of this book. Wyke and Sutcliffe put together this book on how we can be better leaders in the face of unexpected times. And I'll tell you, I've been teaching this to our whole staff at Sutter Health for the last 2.5 years, because to be a resilient organization, there are very important characteristics that have to become part of your DNA regularly. And those, I'd like to just run through the 5 characteristics because they're easily rememberable, but they are preoccupation with failure. And what do I mean by that? Do I mean we should be downer Debbies all the time? No. What it means is always have your plan B in your back pocket. I'm an obstetrician by training, and do I think something's going to go wrong with every natural birth? No, but I'm ready in case it does, because that's the way we succeed. The next one is to be deferential to expertise. When you want to get through a problem like this, you don't need somebody like me in incident command making the decisions. It's really important to turn to those who are at the front lines doing it. And we have learned so many great lessons about how we can really deliver better care from our frontline staff givers. The third one is deference to operations. Be very sensitive to what is going on with your operational detail. It would be very problematic if people in command centers were dreaming up the appropriate workflows without taking into account the people flow. You know, in hospitals, we have visitors, we have patients, we have all sorts of people coming in, delivery people are coming into our facilities. So we have to be very sensitive to the operations that's going on a regular basis. And then we have to be very cognizant of being absolutely dedicated to resiliency. What that means is that we can't just wring our hands, we can't just say, well, I guess that's what's going to happen to us. We have to be every single moment, what will the next day look like, and how are we going to surmount this struggle? If as organizations, any of us, whether it's in healthcare or any of the other member organizations within the Bay Area Council, are not dedicated to that, we're almost likely to fail. There are going to be cement trucks that pour new cement over us, but we have to be commonly dedicated to being the little plant that grows up through the cracks in that cement. So I think it's really important, and what we have learned in the course of this is how rapidly the delivery of healthcare can change. For example, we have had significant drops in the number of our patients that are being seen in the office. That's happened because we don't want to expose them to potentially other patients or infections. How have we managed to care for patients? We've boosted enormously our telehealth visits. Now, there were some recent laws that were passed in the state, but they were not due to go into effect for another year. Similarly, at the national level, by really working with our legislators, we said, you know what, let's just make it happen now. We have the technology. We're in the Bay Area here. We know how to do things with devices. And fortunately, through our work with legislators, we were able to lift those requirements and are now able to offer that to our patients. On a go forward, I anticipate this is going to be one of the lessons learned from our whole experience here. We will get very many changes in the way we deliver healthcare on a go forward basis, just as a result of that. Patrick, I'm going to stop there. You might have a couple questions from a healthcare perspective that I can answer for you.
Yeah, thanks so much, Bill. It's all just so fascinating how rapidly things are changing. And I guess, we're all thankful that they are. So we've got a couple questions, and I even had this question. A lot is being said about hospital preparedness, a lack of supplies, that sort of thing, which I think, we're reading about in the media, seeing on CNN, and I think the way it's being talked about is making folks a bit nervous. Can you tell us a little bit more about sort of the inside details about how health systems are preparing and how prepared do you feel?
Yeah, well, it's a great question, and you never want to say, oh yeah, we're totally prepared, right? Because who knows what could happen? Who knew that a week and a half ago New York City would be where it is today? But I will say we have been doing both within our own individual systems and across systems, doing everything humanly possible to conserve these personal protective equipments, the masks, the gowns, these kinds of things are really, really important. And for example, many of us on this call may have gotten a call from our own physician, we're going to be canceling your elective surgery. We are virtually across all health systems making early efforts to really postpone any elective surgery, because each time we take a patient to the operating room, a couple things happen. We consume a lot of these consumables because we want to protect our healthcare workers and our patients during the course of an operation. Secondly, we use a lot of equipment like anesthesia machines, recovery beds that could well be used if we have to face what we call a surge. A surge in hospital language is when suddenly we're faced with a mass casualty event, something unexpected, just like this rampant infection, where we would want to deal with a lot of patients at once. We have to be ready to convert many of our beds that are otherwise not used for critical care into that modality. So our system, I'm sure, I know this from an insider's view, but virtually every system in Northern California, as well as those in Southern California, have actively developed their surge plans. We're talking about ways that we can convert medical surgical beds into ICU beds. We're converting operating room beds into critical care beds, recovery room beds into critical care beds, all in the interest of being sure we have sufficient numbers of respiratory support devices and care to care for an anticipated number of patients. I hope that answers the question. If there's anything else.
No, that's great. And so this is why we're, again, this is something that's being reported in the media a lot, but this is what the physical distancing is for, right? And so we're trying to, folks are hearing flatten the curve quite often. And you folks leading health systems are trying to, control the surge to any extent possible. Can you tell folks a little bit more about that, and/or have we seen a surge or just a slight uptick, or is that we're still kind of holding our breath and waiting, or where are we here?
Yeah, holding our breath is an interesting turn of the phrase, Patrick. Would that we could all do that for several months, right? Yeah, so it's a really great question, and I think if the group will indulge me for a couple minutes, I think it's important to understand this concept of flattening the curve. So this virus, this COVID-19, we all wish we'd never had it in our lexicon, right? That would be one nice way to do it. But it's in the family of viruses, just like the common cold virus. The difference between this virus and other coronaviruses is that its virulence is somewhat higher. That means its infectivity seems to be more effective at transmitting from one person to another than the common cold viruses. For viruses like this, we calculate something called the R0 or R0. And what that value is, it talks about the number of people one exposed person is likely to pass the disease on to if they come in contact with them. The R0 for COVID-19 is around 2 to 3. So what does that mean? What that means is that if somebody who is COVID positive, let's say a child, has a birthday party and has 15 or so friends over, they're likely to transmit it to several of those friends. Now, if they go home and go to school just as usual, interact at the usual social distancing that we're familiar with, hug, draw pictures together, interact with family at the dinner table, go out to the malls, the likelihood in 15 generations, meaning one of those people exposes 2 to 3 more, those 2 to 3 go out and do the same activities, that's the second generation. If we go through 14 generations like that, that exposes about 15 million people with normal social distancing. So that's a pretty profound passage of this virus. It's very effective at contaminating a lot of people. Social distancing has an enormous impact on that. We can cut those numbers quite significantly by staying indoors, not going out, making sure that we're within 6 feet of others. And if we have to be any closer than 6 feet for any longer than 10 minutes, we should have a mask on. That's what we use in our healthcare facilities all the time. Whether you're caring for a COVID-19 patient or a regular patient, we use the 6 and 10 rule. So 6 feet, 10 minutes, anything closer than that for longer, that you ought to have a mask on. Now,
that's a great rule.
Yeah, it's great. And there's a lot of videos out right now on how we can all make our own cloth masks. Please don't run out and think I've got to start buying a mask and then I can go out and interact with the public at my usual rate. If you have to go out for your grocery shopping or important things like that to sustain your life, do so. And steer clear of others. Remember, as you walk through a grocery aisle, you're unlikely to be in contact with another person within a proximity of 6 feet for longer than 10 minutes. Stay back from others in lines and do as much of your shopping online as you can. So that's an important aspect of, of social distancing. And in fact, because of what I mentioned earlier, that we had patients early on, we started investigating this concept of social distancing quite early. And that's why the mayors of the 7 jurisdictions here in the Bay Area met early on, because of the recommendations of the health officers in their counties, to actually start the shelter in place earlier than the rest of the state had. And in fact, that has been really providential for us. It has been a hassle. I know people get frustrated with it. And there are some tactics we can talk about later to maintain your sanity and your health while you're in your home. But it is really very beneficial that you are there.
Thanks, Bill. And I think a lot of people in the Bay Area, people aren't liking this, and it's not been great for the economy. It's not been great for a lot of things. But I think, I sense that California acted early, and that some of our residents are a little bit more willing to do this than those of other places. The last question before we move to Kristin I had was, how does California's experience differ from New York's experience?
Yeah, it's a really great question. And we've got lots of epidemiologists across the country and across the world that are actually looking at that. because as you well know, suddenly it just sort of exploded in New York City. And there are likely some features to that. Number one, New York did not begin the shelter-in-place rules and the social distancing nearly as early as we did here in California, especially here in Northern California. So, given the fact that we had some of the very first COVID-19 patients here in California, the fact that it has not blossomed is quite interesting and likely can be attributed to some of the tactics we began early. The second thing is in New York City, think about it, the density of people per domicile is very different than we have. We're fortunate here in California. We don't have large numbers of people living in close proximity to one another in tall apartment buildings. This may be a downside, but we haven't really embraced rapid transit taken by many people. Certainly we would like that, but maybe we can hold off on that for a couple of months to try and pursue everybody riding a train, because in fact, that was probably quite beneficial for us as well. Individual car drivers keeps us away from others in places where they could easily be exposed. Lastly, I think it's always important for us to think that the positive lifestyles that we have embraced here in California, especially Northern California, have actually been quite beneficial to us. I mean, we eat good foods generally. People are very concerned about taking care of their health. There's great exercise regularly, and we have wonderful weather that we can pursue that year round. Your baseline health and the more you can minimize your comorbidities, those things that can contribute to poorer outcomes, the better off you are. And I think all of the healthcare systems here in Northern California, we're focused on health maintenance far more than we are on making people, better from sickness. So I think that's it.
Thank you so much, Dr. Isenberg. And don't go away, because I suspect that there are lots of questions for the Q&A waiting for you here.
No, I shan't.
And if folks want to learn more about social determinants of health, comorbidities, all the sorts of things that Dr. Isenberg was alluding to, you can participate in the Council's Healthcare Committee. Just reach out to me and we'll get you in. So I'm also proud to have Kristin Rivera here with us. Kristin's the global leader of PwC's forensic practice, which is comprised of 3,500 professionals operating in more than 70 countries. But she's also the global lead of PwC's Crisis Center. And interesting for this conversation, this is where she helps companies prepare for, respond to, and emerge stronger from crises. She's helped hundreds of companies navigate through strategic inflection points and leverages this experience to bring clarity and structure to even the most volatile situations. And I think this might be one of those. Thank you so much for joining us, Kristin.
Thanks, Patrick. It would indeed. Dr. Isenberg, thank you for your comments. I've learned quite a bit, and I talk about COVID-19 all day, every day, and have for many weeks now. And this is first and foremost a health crisis, a humanitarian crisis, and the health and well-being of our friends, our family, our colleagues, and our community members. There's no question that's our first priority. But as our research in crisis indicates, and as we were all seeing, this health crisis has triggered an ancillary business crisis. And there are some people that fear that the long-term effects of the business crisis that is coming from this, could do equal damage to our society. And so that has really been where my team and I have been focused, is on understanding those business issues that are impacting companies around the globe. And as Patrick mentioned, I'm responsible for our Global Crisis Center. So our Crisis Center team had been involved both in Ebola and SARS. And so when we only still had a few hundred cases in Wuhan, they began to focus on this issue and began talking to companies around the globe, talking to companies in China, talking to companies in other places to see how they were being impacted, beginning in those very early days. And what we found is that, let's see, go back to that. There we go. Hopefully that sticks. We have found that really there's three waves that companies go through generally as they respond to a crisis. but particularly here in this worldwide business crisis that we find ourselves in. So the first wave that companies go through as they come to grips with the fact that they are in fact looking at a potential crisis is the mobilize wave. And many companies are still here in this phase now. Some are beginning to move on to the second wave. But this first wave is where you're focused on putting out daily fires, focused on these urgent needs that continue to come up. Health and safety here was of utmost importance, dusting off crisis plans, business continuity plans to look to see what guidance they could provide, and focusing on being able to mobilize the workforce, being able to have people work remotely where possible, to continue to operate even though social distancing and procedures are in place, shelter in place procedures. And this creates a number of pain points. This is not business as usual for certain companies are grappling with incomplete and shifting information, trying to determine who and how to communicate with and when, working with the disruptions that are coming to the workforce, not only in terms of the mobility, but also finding that some workers simply can't do their jobs. There's no way to mobilize. And then when they do, finding that their technology was perhaps insufficient in order to fully enable that kind of remote working. This wave is characterized by, feelings of being overwhelmed, in some cases feelings of paralysis, not knowing where to start, and also, sometimes a bit of head in the sand of, this hope that this will go away in a few weeks. This is a temporary solution. I don't need to do anything more permanent. I'll just keep playing whack-a-mole every morning when I wake up, and hopefully this will all go away. But I think most companies now, particularly in California, in part because of our shelter-in-place, our early adoption of the shelter-in-place rules, really have come to terms with the fact that there is a new normal that we will be dealing with for some time to come, and that hope is not a strategy, and that it is time to move to wave 2 and really begin to stabilize their business. But before they move there, we find, and you see these focus areas, we've boiled down the various efforts that companies are undertaking to respond to this into 6 areas. And the first 2 are highly relevant here in this wave 1, and that is your crisis management, your crisis response team, as well as your workforce issues. So these 2 are really the first of the 6 focus areas that companies that we're talking to have put into place. They've put into place teams to manage this at the center from a crisis perspective, and they're heavily focused on securing the safety and productivity of their workforces. But as companies move into wave 2, stabilize, again, they realize that this is in fact a new normal that we will need to operate in for some time to come. And that we can't expect that business will 100% return to normal, by the end of this month or the middle of next month. That this might be something that we will be dealing with, even if it's on and off for some time to come. And so we need to put into place logistical solutions to deal with this temporary new normal. So that includes securing your supply chain, making sure you can continue to manufacture, that you can get raw materials, and also operations. So, many of our companies in the Bay Area and around the US rely heavily on offshore resources, particularly offshore labor. We have extensive teams in India and other locations. And some of those facilities in the coming weeks may find that they are unable to operate. And so understanding the potential impacts of those potential shifts on our businesses is of top concern for companies that we're talking to. The scenario planning to consider what may come and make sure that you have, going back to the first of the 5 recommendations for managing the unexpected, always having a plan B. So understanding what those potential scenarios are and having a plan A, B, and C for each of those is something that we see our companies focused on. And liquidity management is absolutely critical. This really became a focus last week, and this week the change is really now a focus on the stimulus, which some folks are calling more of a stabilization package than a stimulus package. It's not going to necessarily stimulate the economy beyond where it would have been previously, but the goal is to stabilize. And so companies are really thinking through how they can secure those funds and use that to bolster their liquidity. So in terms of focus areas, again, operations and supply chain, somewhat surprisingly, a real focus on the tax. There are a number of levers that companies can pull in order to, and some of this is included in the recent package, in order to get support through taxes, NOLs, and the like. And so a lot of focus there in terms of pulling those levers to secure additional liquidity. And then last but not least, the third wave, and I think this is a really important one, particularly for us here in the Bay Area, and this is the strategize. The idea here is that disruptive events give way to transformation. And Dr. Isenberg, you mentioned that telemedicine will likely increase after this. We'll begin to deliver care differently. I take my son to his pediatrician once a quarter, and it would be wonderful if we could do a 5-minute video meeting instead of us getting in the car, driving, bothering the people. It would be far more efficient. And I would love to see, I think many of us would, that additional efficiency. And I think that's a silver lining that will come from this. Remote working is another simple one. Many people in industries that have not traditionally encouraged remote working are finding that it's actually quite efficient. And that, in our own industry, here at PwC, we're finding that not traveling every week to meet with our clients in other parts of the country is giving us an enormous amount more time to be productive. And so I think we'll continue to see shifts in travel and also in additional, increased working from home. And that will have knock-on effects in terms of real estate and other things. And so all of these things will change the way the world operates going forward. And it's really important for companies to start thinking about that today. And a recommendation we have is put a separate team. Your crisis management team will not have the bandwidth to think of those shifts, those transformational changes that are taking place now. But it's worth thinking about today, because there will be winners and there will be losers from this. And we want our Bay Area companies to be winners. And that's in our DNA. We have a strategic advantage when it comes to transformation. And so now is the time to think of how the world is changing and how we can make lemonade from lemons. As Winston Churchill once said, and many people since him, never let a good crisis go to waste. And so how can we begin to think through, the opportunities? There's M&A opportunities. There will be opportunities to, again, develop new business models or to transform existing business models. And we need to not forget that as we think through how we navigate this crisis.
Thank you so much, Kristin. I'll pose one question that I had for the two of you, either or both can answer, and then we'll jump into audience Q&A questions, which are pouring in pretty rapidly. So, yesterday, Dr. Fauci said, you don't make the timeline, the virus makes the timeline. And so how should we be thinking? You alluded to this a little bit, Kristin, on sort of planning for various scenarios and timelines, but how should we be thinking about the timeline here, both from a health and business perspective? Do we need to be prepared for a longer haul and possibly a return of the virus next fall? I started seeing things today that the real Spanish flu epidemic took off not in the spring when it got into each of the countries, but the following fall is when it really took off. Any thoughts on that, Bill and Kristin?
You want to go, Kristin, or
I would love to hear from the physician first, and then I'll comment on what we're hearing in the business community.
Yes, well, if we look at the Imperial College from London's projections on sort of the cyclicity of this in the immediate short term, we're expecting our surge in California, if it follows that pattern and what we're seeing in New York, that early next week we should start seeing a big ramp up. And I alluded to some of that happening in the very first data points that I shared with you. Now, how long that will last, it really depends on how effective we are at managing the surge. I think I know from our facilities perspectives and from everything I've talked with other chief medical officers, our healthcare systems here in the Bay Area are quite well prepared for what we're facing. That may well change just because as the seasonality changes, as we know, cold season, flu season, they're ramping down right now anyway. And so if COVID behaves like the influenza virus and the common cold virus, we may be benefited there as well. So it may be a shorter period and we might see some resumption of normalcy by summertime. But Patrick, I think you raise a really good question about what happens next year. And I think that's why the intensive contributions of our biotech partners to get to a vaccine are that so important, right? Because vaccines help. It's why we don't see such bad flu. It's because we take the vaccines every year. Kristin, you've got insight.
Yeah, and so from a business perspective, we have to consider not just where we're at from an outbreak or pandemic perspective here in the Bay Area, but around the globe, right? We were impacted. Many of our companies were impacted when this was focused in Wuhan because of the high concentration of manufacturing there. We will be impacted if India is impacted in the coming weeks or months. And so I think, and again, not being a doctor, but I think that until a vaccine is found, the general expectation is that we'll continue to see periodic outbreaks in different locations. And so there will be ongoing impact with parts of the world or, cities or locations, not operating at maximum efficiencies until a vaccine is in place. And I think what I hear is that, 12 months would be remarkably fast. 18, I think, is probably more realistic. And so even if you look at the US government's COVID-19 crisis management plan that was published last week, they cite a 12 to 18 month expectation until this is past us.
Kristin, we have different, the cyclicity of influenza changes depending on which hemisphere you're in. So for example, the Southern Hemisphere is 6 months ahead of us in getting flu each season. And we actually base a lot of our preparedness on their experience. What would be the economic impact if in fact COVID starts hitting the Southern Hemisphere pretty soon?
Yeah, no, I think that's exactly right. And it will vary by company depending on, what kind of operations they have, raw material sourcing, and the like. But that's one of the, we've often heard, oh, this might die out in the summer. But the problem is it's summer in the other hemisphere right now. And so, given how this is spread worldwide, I think going back to hope is not a strategy, we're recommending that companies have plans that take them all the way through, an 18-month cycle and expect, business disruption through that time frame.
Thank you.
Great. Many questions on this one. 3 or 4 now. Folks are curious about where the state of testing in California and the counties and cities, but also where can we get this data at, sort of the most granular level, at sort of a regular, on a regular basis versus just hearing headlines here and there. Is there a place that we can go to find kind of centralized testing numbers, Bill?
Centralized testing numbers are a little bit difficult to get right now. Number one, tests themselves are very rare, and I'm not sure how many of you have heard about this, but it took a whole lot of work on our part. In fact, a lot of crusading with legislators locally. Early on, California was not identified as, quote, a hot spot for this, despite the fact that we had some of the very earliest cases here. And I shared with you the data around Santa Clara. But, could be for political reasons, who knows what. But Washington was getting a lot of attention with tests, and now New York is certainly getting broader access to tests. Fortunately, with the recent approval of a couple of different suppliers, Roche and Cepheid, we're now getting much more availability of testing. But I have to say, all of us in the healthcare arena, we are currently restricting testing to those patients that are symptomatic. That is appropriate because it helps us manage our resources. We don't want to consume these personal protective equipment resources on patients who do not have COVID. So we want to get their test results back really rapidly so that we can care for them appropriately without wasting resources. What that does, however, is it means we don't really know what the incidence of COVID positivity is right now. We don't really understand it until we start testing large numbers of people. We're hopeful that since these tests have now been FDA approved, that the factories that produce the tests have sufficient bandwidth to keep up with the testing we would like to accomplish. There's currently not within the state a consolidated way to see the number of tests other than just the total positive patients. That's all we get from the Office of Emergency Preparedness right now.
Great, thank you, Bill. Is it possible that companies in the future just continue remote work if they realize that this might be the new normal for a while, or at least it might be prolonged, but also they realize, real estate's expensive in the Bay Area, they can cut costs, some of the accounting firms, consultancies, I'm sure PwC, Accenture, others kind of experimented with hoteling earlier on. But do you think that we'll see this finally take a real hold, Kristin?
So I think so, within reason. You mentioned, PwC and the other big, accounting and consulting firms have been doing, remote working with hoteling and having more optimized space for many years. So it's something that's very normal for us, and working remote is very natural. Now, to be fair, we're not accustomed to working from home with small children and dogs and no nannies or daycare or schools to take care of the little ones. So that's been an interesting challenge for many. But we're all getting used to being on conference calls with children on people's laps and dogs wandering through, which actually I think people are enjoying. But I do expect, there are many companies that I know personally that I've talked to that weren't really doing remote working in any meaningful way, and their workforce are learning to do that. And I think there will be a sort of a middle ground that's ultimately found after this, where it will be much more common and much more prevalent. And there will be related, implications to that.
Patrick, may I comment on that one?
Absolutely.
Yeah, so I'm like Kristin. I think it will make changes in healthcare delivery, but not widely. As I mentioned, I'm an obstetrician. I still don't know how to deliver a baby across a computer terminal. So I think there are going to be some areas where we still need to go into the hospital, which actually is enriching for all of us, patients and physicians, because frankly, we don't go into medicine because we want to be all the time just looking at data. We want to be caring for people. And so we want to get to a point where social distancing doesn't have to apply to our doctor-patient interactions. So I think, but there are many, many ways that we're already learning, and Kristin alluded to those. Not only is it is it an equally acceptable way to have a doctor-patient interaction through televisits, but it also saves extraordinary time and hassle, just the frazzle factor of driving to the office, finding parking, sitting in a waiting room. Those are all non-value added time consumptive events. And, all of us in whatever industry we're in should be doing everything we can to make every minute our customers are involved with us value added.
Yeah, I think that's great. And I do think that we'll find a sort of new normal where certainly there's no replacement for the patient-physician interaction, nor is there a replacement for the client-consultant interaction. Interestingly enough, the Bay Area Council I was leading our sort of investigation into, the potential of a remote work day here or there, each week. And then all of a sudden we were full-time remote. And so, we upgraded some of our tools, we've made some changes, but, I think like most organizations, we found that it wasn't as hard as we thought it was going to be. Yep. And in fact, some folks have found their work days much more productive. Of course, I don't think that, the Bay Area Council is going to become a remote only environment anytime soon. And in fact, we love seeing our members and hosting meetings in person and panels in person. But yeah, it's interesting. And our Bay Area Council poll just found that 63% of respondents are working from home now. So that's also pretty interesting. 2 or 3 questions here, Bill, about how health systems are coordinating with city, state, or national agencies, or if they are, or sort of how those pieces work there. Can you tell us a little more about how that all works?
Yeah, it's a great question. And in fact, Patrick, I think one of the, as Kristin mentioned, it's great for us to be logging all the beneficial outcomes of a crisis like this, to remember them and actually celebrate them. I think I mentioned the chief medical officers from all the different health systems across the state. We meet once a week, and we have on that call the California Hospital Association representatives as well, as we talk about ways that we can partner more effectively to not do things like, well, we have something called patient repatriation. So if a Sutter Health patient shows up at a Kaiser facility, they're transported back via vehicle to one of our facilities and vice versa. And we do this regularly right now as part of our agreements for our patients. We're realizing in a crisis time like this, we just need to trust one another, trust that we all basically have the best interests of our communities, not necessarily our own aligned patients at heart, and realize that putting a patient who may have COVID into a rig and exposing precious and crucial EMS services to infection is not the smartest thing to do. So we're working to make sure that none of us activate our repatriation agreements, and we'll just care for one another's patients in times like this. Furthermore, the state has pulled together, I mentioned the Office of Emergency Services. There is now a coordinated effort at surge planning at the state level. So we have participation. It's being overseen by the California Hospital Association, but there are partners from virtually every healthcare system that are involved with this. And as you know, the state is looking at various hospitals within our own communities here that have been recently abandoned or about to go into receivership that will be taken over by the state for housing COVID patients. We've learned from other countries that the sequestration of COVID positive patients from those who do not have it is one of the most effective strategies from keeping the spread to go on. So I think the state, the city, municipalities are being very involved, and we're all trying to work together at this and not have parochial interests at heart.
That's great to hear. Kristin, do you think that the framework you presented earlier can be applied not to just sort of larger organizations and corporations, but to governments as well, to help them, I'm actually thinking to deal with maybe multiple crises at a time. I mean, there's now talk, I'm looking out my window here in Oakland, and it's, partly cloudy, but fairly sunny and hasn't rained in a month. And if wildfire season hits us earlier than normal, governments, municipalities, the states are going to be under a lot of strain. Do you think there's some learnings we can take to help prepare for that?
So first of all, your point is well taken. As I mentioned at the outset, we conduct a global crisis survey, and one of the things we know is that ancillary crises often occur, and sometimes they're related or triggered by the original, and sometimes they're just piled on, and that's often really where things go awry. Right. And so we need to be prepared for that. And in fact, wildfire is one that we've had a wildfire every year for the last few years. So, we need to prepare that somewhere in California, it will happen this year, especially given our rainfall levels. And what if that happens while we are, in an outbreak or pandemic cycle? So yes to that. The framework, interestingly enough, I think it really does apply, and it even applies at the individual level. I mean, if you think about ourselves, right? Many of us went through a phase of, is this really a thing? Do I need to do anything, right? And then, when the shelter in place went into effect, we began to stabilize, and I think, we took the action we needed to be able to live in this new normal for a period of time. And our schools is a great example, right? Our schools spun up online learning very quickly. I have a friend in Idaho that has not happened. The schools there just said, sorry, we don't have anything for you, figure it out. We heard Khan Academy is good. But here, my kids are in public school, and, we have Google Classroom, and they're on Zooms all day long like I am, which is taxing my internet bandwidth, but otherwise it's working. So I do believe this framework is just as applicable for governments, and thinking through that scenario is really a key step there in terms of what are the things that could pike, and planning now. It seems silly to be in planning mode, but I think from a government perspective, in particular, that's absolutely what needs to be happening. Again, assuming that this won't all, be finished and we're back to normal, in a matter of weeks, which seems highly unlikely.
Great. We've only got 5 more minutes, so I'm going to end with the $1 million question. There might not be an easy answer for this, but I'll pose it anyways. What signs are healthcare professionals looking for when determining when the physical distancing, sheltering in place are no longer needed, or at least we can kind of see an end date in sight?
So it's a really great question, and it's one that we're vexed over right now. As we collect this data. The reason that I'm sort of all over it regularly is to look at, quote, the curve. And when we can start seeing that the curve is flattening out and we're not experiencing this exponential rise, I think that's when we can start at least having conversations about the relaxation of this. But this is one of those, Patrick, where we do not want to move too fast. I heard just this morning, for example, that one hospital has decided, well, we're not having too many patients, so maybe we'll go ahead and start a few elective surgeries. I have to say, I'd much rather hang on and put it off for another week or two. I know it's frustrating for patients. I know how badly you feel if you have an elective operation coming up and your doctor's called you, but it's really in your best interest to hold off on that. So until we have sure signs that we have surmounted this, I think we should just manage to stay at home and stay in place, but realizing that we're social animals. So social distancing means stop hugging, stop bumping into each other and shaking hands, but it doesn't mean not talking to people on the phone, not Zooming with one another, not interacting, because at base, we are very social creatures, and it's important that we maintain these connections. Look, for example, we can see one another's artwork regularly now that we're on this call together, right? We realize that we're all living in different places, and we're interesting people beyond what we do for our jobs. So let's make sure that we nurture that part of ourselves during this crisis.
And there are wonderful things we can do. My own team, we've had evening virtual cocktail hours where a number of us have gone on at 5:30 or 6 and had a glass of wine together. We've had, in fact, I'm doing that with one of my clients tomorrow evening. We've had family nights where we've each had our kids gather around and shared what the kids are doing with each other. We're having a virtual book club tomorrow as well.
So fun.
So lots of things you can do to stay connected. And we've been staying very close with our team members, and there are many, some of our people live alone. Some are experiencing severe anxiety. So it's really important that we don't forget to check in with our team members as we go through this. Everyone is experiencing this differently, and experiencing just the distance differently. And so now is not the time to forget to connect, and the tools are very helpful, and so don't forget to do that.
Both beautiful notes to end on. Dr. Isenberg, Kristin, thank you so much. To all those who participated, from myself, from Jim, from the Bay Area Council, we really appreciate you joining. We really appreciate our community. We're doing our best to work across communities, industry groups, with our Economic Institute to ensure the safety and stability of the region. Hopefully you can join many more of these. And I just thank you all so much. So that's a wrap. See you all next time.